it's funny because you do neuropsychological testing, for example, and you're like, okay, well, how did somebody do when the question is about whether or not they have ADHD on attention tests, right? Or attention rate. Well, those are obvious. But, our discussions earlier, and I thought it would be really interesting to talk about is like, well, what patterns do you see on the testing, or when you're talking to people, like, what are your observations that they're not even testable, but we see this all the time. And I think it's pretty fascinating, but it also speaks to like how the condition really manifests in people's lives. You know what I'm talking about? Remember, we're talking about like the testing, we're going over those testing results. You're like, yeah, we see this all the time.
Yeah, for sure. I mean, certainly on testing, we'll see a lot of people just making lots of careless errors and really intelligent people. I mean, people who have IQs of 135, 140, who have incredible gaps in their knowledge just because they couldn't pay attention growing up and they've missed really important things. I mean, I've seen really tremendously bright people. I mean, really, we're talking people with an IQ of 140 who can't do long division because they couldn't pay attention when they were in fourth grade and they never learned it. And certainly, if you're not an engineer or something like that, like you're probably never going to need to do long division. Who cares? But that's just an example, right? Yeah. I worked with a young man who was in graduate school who had never learned how to write. Because he couldn't pay attention long enough to learn how to write. And it really became a problem for him because in graduate school, as you know, you do a lot of writing.
Yeah. And, even the patterns within testing, like we're asking, part of the IQ test, for example, we're asking factual information, like, let me ask you a question that most people would know by the fifth grade, some kind of geography question. And you're like, how'd you get that one wrong? But you got, this super complex, pretty obscure question right. Like, obviously they weren't paying attention. Or, when you're looking at patterns of scores and they go in ascending order and they get these super easy ones wrong, you're like, wow, you were really distracted by, something that was almost right. You missed this little detail.
Right. And that's what we tend to see happening in people's lives as well. I work a lot with adults who have ADHD and in many cases unremediated ADHD. And typically they're very intelligent people who are highly creative, who have really excelled in a very specific area and cannot get other areas of their life together. And it's the same sort of thing, right? Give me a really challenging aerospace engineering problem and I can solve it because that's something that I'm really interested in and that's so complex and I can do it, but I can't remember to close the cupboard doors when I go into the kitchen and now my wife is filing for divorce because she just can't take it anymore. That's kind of what we see. And I think oftentimes there tends to be kind of a misconception that we really need to build people up who have ADHD. And I think in general, we need to build people up. That's very true. But I think this attitude of, kind of ADHD is a gift and it means you can be very creative and it means you can be very flexible and very dynamic. All of those things are true. But I think that minimizes the level of suffering that people with ADHD experience. I see it all the time with people coming in. Adults, we give them an ADHD diagnosis and it changes their life because it legitimizes their suffering. I mean, they have been deeply suffering. People have been fired from their jobs and they burn through relationships and, nobody wants to be with them and nobody wants to be around them because they're challenging and they have behaviors that are challenging to be around.
I mean, we live in such an unfriendly ADHD world. It's like people hide it as much as they can. And the more intelligent, typically, the better they're able to do that until they get to the breaking point. The bar is raised high enough. It's almost like when somebody has a word finding problem and they're really bright, they just use a different word and nobody knows they're searching for all these other words. They can't find it. So they use the easier one because they could access it. But they've learned that, if they're really honest, that they're going to be shamed for it. Where do they learn this in education? Teacher, oh, you're just lazy and you should just try harder and all these things. But we see this. It's funny when you're testing somebody, and it's so confusing to so many people. Like, well, why can they pay attention to this thing? It's super interesting to them, and not this other one that's boring. But you see, it's the easier things. They're like sitting back in their chair, like this is so easy, and then they make these errors, and then they get into this just right space, and they're like, I can do this. And then it gets so hard, taxing, maybe their weaknesses that we can exploit with our testing, and then they don't do so well. So it's almost like the sweet spot. But, a lot of people have this, like with video games, or like with the things they love the most, like novels they like to read, or science, or, well, I don't have an attention deficit. And that's the thing, it's not a deficit. It's a regulation problem, and usually for things that you're not very motivated or interested to do.
Yeah, it's such a good point. And, a lot of that, when we do QEEG brain maps on people, we can really see some of that stuff. Yeah. So ADHD is a disorder that affects the frontal lobes in your brain. And essentially what has happened is that during the course of your brain development, your frontal lobes have developed at a slower rate than the rest of your brain. And so that's where you get this kind of stereotypical, like, I can be sort of a genius in a few areas that I'm highly interested in, but I can't sort of remember to like brush my teeth in the morning or like tie my shoes, right? That's what can happen when somebody's really interested in a specific area. Say, for example, with children, it might be Legos, right? Mm-hmm. Like we all know those kids who, they might be bouncing off the walls and they can't sit at the dinner table for more than 10 seconds, but they can literally be engrossed in Legos for hours. And you can even call their name 100 times and they're not going to hear it because they're so lazy on those Legos. Yep. And it's because it's activating different networks in the brain. Yep. So when if I'm a 5-year-old doing Legos, I'm using my salience network in the brain. I don't have to use other networks that are involved in attention like I would if now I'm having to sit down and do a bit of schoolwork or a bit of homework. And we can see that in the brain imaging that we do. And if we can see it, we can help strengthen it and help people get better and overcome their ADHD.
That's even that hyper focus. People, oh no, they can really, really focus. But that, I think part of the problem in our society is, academics it hasn't adjusted to the demands of, or the needs of certain people. And so, well, what do? You sit in a classroom and you're lectured to and all the things. And if your brain isn't, really focused or interested, and that's what you were talking about before, you can see the holes, and then you can see these problems manifested in their brain maps. What does maybe 80% of the brain maps that we look at for ADHD, what do you see in a brain map?
Oh gosh, yeah. You see frontal lobes that are half asleep. We call it frontal slowing. So the way to think about it is your frontal lobes are responsible for what are called your executive functions. So those are going to be things like planning, organizing, time management, and then also things like impulse control and behavioral regulation and decision making. Yeah. So if you have frontal lobes that are half asleep, all of those things all of a sudden become very hard for you. And what we call that is frontal slowing. And that's literally what we can see in people's EEG. Yeah. In their brain maps is we can see that the frontal lobes are actually moving too slowly. And in many cases, they're also not well connected with the rest of the brain. So now you have the rest of the brain kind of doing its normal thing. And then you have frontal lobes that are just not sort of catching up. And that's where you'll start to see folks experiencing a lot of impulsive behaviors, difficulty paying attention, trouble staying organized and making appointments in time and that sort of thing.
Yeah, is fascinating. There's a lot of research. Dr. Russell Barkley talks about this all the time, that people with ADHD are about 30% behind their peers in their maturity of those frontal lobes, and they never catch up. The misnomer is like, it's a delay. It's not a delay. It's you're falling further and further behind. Yeah. And I think the difficulties are that while especially people are very bright, can still do well, they still have this huge untapped potential. And, there's an underappreciation for where they're affected in the executive functions, which, if we were to fast forward 30 years ago, the job demands and the things of today, and now if we would have never guessed where we are today. I would have never done that. Alvin Toffler and others who write about these things were close to it, but I don't think until we lived it, we would know exactly where we are. But now fast forward another 30 years where technology is growing the shape of a hockey puck. Where are we going to be? And the thing that we know for sure is you better have a very good, adaptive, flexible brain that can switch into different modalities, or it's going to be really rough to maybe have a career and do the things you need to do to provide for yourself and your family.
Definitely. Yeah. And that actually brings up a really good point, which is that cognitive switching, that ability to sort of switch back and forth between things really quickly and be very flexible and adaptive. People often think that people who do suffer from ADHD can do that pretty easily, and actually that's not the case. What we find is that people who have ADHD and who suffer from ADHD, it's actually very hard for them to sort of switch their mental set. Every time you're switching your mental set, every time you do that, it creates a drain on your frontal lobes. And so when you have ADHD and you have frontal lobes that aren't really running with a full gas tank in the first place, and now every time you have to switch your mental set, you get sort of drained out much more quickly than somebody who doesn't have ADHD.
And you see these, especially these young children, and they try to keep it together most of the day. And by the time they get home, they're exhausted. And so they look like, parents are like, why are they having such a hard emotional time? Their emotional wreck. Yeah, well, they've tried to keep it together and they've had to work extra hard to do that all day long. Meanwhile, the teachers are like, you're lazy, you're not trying hard enough. They're getting all these negative messages. And I think the super unfortunate thing is if this isn't found early enough, and usually the brighter the later, because they've been able to overcome at least to some degree. Well, they're doing okay. They're getting A's and B's, but they're working extra hard to do that. And with these messages they're getting, now starts to creep in the anxiety, the depression, the low self-esteem, the low levels of self-efficacy, and they feel defeated, like no matter what they do, it is not working out the way that they feel it should be able to work out for them.
Yeah, it's such a good point. We see what's called a high comorbidity, which means a high co-occurrence between ADHD and then also depression and various anxiety disorders. And I think you're right. So many kids, especially ones who are very bright, they can sort of compensate until they get to a certain point, but it takes a tremendous emotional toll on them to have to do that.
Yeah.
It's so much work for them to kind of manage themselves all day long, and then also be hearing negative messages on top of that.
Yeah. And then, it's interesting because when we see these young people, they almost don't believe us when we say, like, look, you're really smart. They're like, yeah, but I don't feel that way because, my friend Johnny or Sally, they don't have to try so hard to get the same results. And they're pretty surprised. But then when we do the testing and we put our finger on the difficulty and we do the map and show them, and then over time they get better, they stick their chest out and they're like, yes, I can do this. It's interesting because instead of focusing on the anxiety and depression, you go to the heart of the problem, and they turn that around themselves, like almost like going to a personal trainer through the methods that we use. Then they feel better about themselves, and then the anxiety and depression, sometimes they need some help through that, but it's less of an issue because they actually can do all the things that they knew they could do because they're so smart.
Yeah, that's so true. A lot of kids, they come in, they do the neurofeedback, their frontal lobes get so much stronger and catch up in terms of their development, and all of these things that they couldn't do before now have become so much easier for them. Sometimes the anxiety and the depression, it tends to just sort of work itself out because really the primary problem was that they were struggling so much in school and in life and socially. Some kids need a little extra help with some counseling or some therapy, but really many of them, if you work on the ADHD using our methods, they get so much better very quickly.
One of the things you just brought up is so, I think, underappreciated, and things that go right by people is the social difficulties that people have. when they have like, ADHD or anxiety, depression. And I know you've recently worked in the schools and, all the people you're working with recently. Wonder if you could speak to that a little more of like what you've seen.
Oh gosh, yeah, absolutely. I think when we tend to think of social difficulties and social deficits, we typically tend to think of autism spectrum disorders, which is, that is also a social disorder. However, part of what goes along with ADHD is because you can't pay attention. That means you're also not very good at paying attention to some of the nonverbal communication that your peers are giving you. And so, if you and I are having a conversation, right? And, if I'm sort of very engaged, that's great, to keep going. I'm kind of leaning in, I'm listening, I'm making a lot of eye contact. It's very clear that, let's keep talking. I find this really interesting. Mm. Now, what if I'm kind of like, yep, right. Those are clear signals that I'm done. I'm kind of done with the conversation. I'm no longer interested in this and I gotta go wash my hair.
Yeah.
Right. If you're somebody who has ADHD though, you are not gonna pick up on those signals.
Yeah.
And so what happens is peers of children become very frustrated when children with ADHD and adults with ADHD as well are not picking up on those nonverbal signals. Everybody gets kind of frustrated, and many children actually end up losing friends as a result. Yeah. And that's just kind of that's a more subtle thing, but sometimes there are even more overt behaviors, and children who have the hyperactive form or the combined type form of ADHD, they may engage in a lot of really hyperactive behaviors like hitting and shoving and that sort of thing. And, friends don't like that. And so then we'll see kids are not being invited over for play dates and nobody wants to have them over because the other kids don't have a lot of tolerance for those hyperactive types of behaviors. Yeah. And yeah, some of this, it happens in adulthood as well. I'm sure we all have that one friend who we're like, yeah, oh my gosh, you just talk and 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 talk. And we can't ever shut you up and nobody can get a word in edgewise. And sometimes that person can be the life of the party, but sometimes you're like, man, I gotta go home. Like you've held me hostage for 3 hours and like, yeah. I gotta go, right? And, so that can be really difficult for people too when they're adults as well.
It's interesting to think about the developmental expectations of socializing over time, right? So when you're little, you're doing parallel play, and as you get a little bit older, you're in elementary, maybe you're doing a thing together, or maybe you're relating together in some way, and as you hit junior high and high school, there's more of a focus on relating to each other and having, this interpersonal intimacy at some level, and that becomes increasingly difficult and more obvious with a person suffering from ADHD because they're not always there. They're not, whether or not they're looking right at you, they're thinking about like, what's for dinner tonight? Or maybe I'm wanting to play Nintendo or something. And it's interesting when you talk with them and then they ask you a question on something you just spent 10 minutes talking about in the conversation with a group of people. Clearly they were disengaged. And over time, like you're saying, and as, the expectations get higher, that gets annoying. And, I know you've worked in couples therapy with people and, they're struggling with these issues and they want them to get better. And there's limitations based on that condition.
Oh, absolutely. As a matter of fact, when I see people for couples counseling, if one partner has ADHD, I actually require that they get treatment for the ADHD prior to the start of couples counseling, because otherwise the couples counseling actually doesn't work. Because you have one person who's, sort of can't keep it together and is having a really hard time just doing kind of their activities of daily life, staying on top of, brushing their teeth and flossing their teeth and doing the laundry and like picking up their dishes from the table and that sort of thing. And they're not doing those things on purpose, right? Those things can be very annoying to our partners, but it's not intentional. And so there's no amount of couples therapy I can do to fix that. And so I say, okay, you have to go and you have to do some treatment. You have to go do some neurofeedback.
Yeah.
And really work on the ADHD, and then come back and see me in 3 to 6 months.
Yeah.
And then we'll do couples therapy, and then it will be really helpful.
Yeah. I mean, I've even heard you recommend, whatever your treatment modality is, go get some medication, whatever it is, but this is not going to get better unless you do something about that thing. And what's fascinating is, there's this window of time. The younger, the better. So, if we can see a young child, we've seen them as young as 2 years old, but usually it's not till 7 or 8 until people are starting to come in to see us. There's this sweet spot of doing something about that prior to this accelerated growth of their executive functions, for example, and they have what we call this meta awareness, like this awareness of my part in this problem of these interactions. And I know you've seen this in your adult and couples where, the affected partner is like, yeah, I'm not that bad, it's fine. And they just don't even meanwhile, their partner is like, come on, man. They don't have the awareness of how they're coming off and how this is constantly being a problem and annoying. But then when they get the help, what does that look like?
Oh, absolutely. Yeah. I mean, once people get help and they really work to address their ADHD symptoms, and, certainly we have lots of different therapies and treatments and interventions that can help with ADHD. Typically their lives improve dramatically. It's actually really amazing and inspiring to see that people can get so much better and really go on to have so much more fulfilling relationships, because their partner isn't mad at them all the time that they're leaving the silverware drawer open, right? Every single day.
Right. Awesome. Well, thank you for this. It's very informative about your experiences.
Yeah, absolutely. Thanks. It's been a pleasure.
Awesome. Well, we'll do more videos like this into the future so you can learn more about our experiences and what happens with people who aren't treated, who are treated, how they can get help. Thanks a lot.